In this episode, Dr. Eva Norman shares her path to physical therapy. She discusses how one-to-one and at-home physical therapy can be beneficial for individuals struggling with chronic illnesses and allow them to make better progress. Tune in to learn about how to maximize physical therapy in chronic illness management.
Podcasting from Dallas, Texas, I am Shireen, and this is the Yumlish podcast. Yumlish is working to empower you to take charge of your health through diet and exercise and reduce the risk of chronic conditions like type 2 diabetes and heart disease. We hope to share a unique perspective and a culturally relevant approach to managing these chronic conditions with you each week.
Dr. Eva Norman is a physical therapist who founded Live Your Life in response to her passionate desire to offer to her clients, patients, and the public services both in-home and the community that could help them experience health, wellness, and a more active lifestyle throughout their lifespans. Welcome, Dr. Norman.
Thank you, Shireen. Appreciate the opportunity to share a little bit about myself and perhaps physical therapy.
An absolute pleasure having you on. So, Dr. Norman, diving right in, what really led you to a career in physical therapy?
Yeah, it's quite a life-altering story, and I love to share it. When I was 13, I was involved in a hit-and-run accident where I was told I would never walk again. The surgeon wanted to amputate my left lower extremity, but my parents were adamant that an amputation was not necessary. After 4 months of rehab in an outpatient clinic at the hospital, we got a letter in the mail saying that we had reached our annual cap for insurance for that year. So my parents were forced to find a physical therapist that could come to the home. At the time, I'm 13 years old. Even today, we all struggle finding home care services for children in their homes. And as sad as this sounds, but my parents actually had to put an ad in the paper and had to look high and low because they had called every clinic, hospital, hoping to find someone because no one would take private pay to continue my rehab process. And I was nowhere near, sadly, achieving the goals that I wanted to achieve, which was walking again. And so thankfully, we were able to find a physical therapist who truly was extraordinary. I'm trying to protect her privacy, so I will not be mentioning her name, but it was truly a life-altering experience. She made me believe that I would walk again because I had doubts. I had gotten very depressed during that time, actually tried to commit suicide. So I've experienced deep depression and extreme pain in my lifetime, which honestly has helped me in my career, obviously being able to empathize with many of my patients. But after 8 months of intensive rehab, working very hard with her in an in-home gym that her and my father had built in her garage, I walked really for the first time, and shortly after really walked with no deficits. And today I engage in marathons, triathlons, and numerous activities that perhaps science would have disproved back then that I would be able to do. But I have both legs and I'm healthy today, thanks to this physical therapist.
Oh, wow. What a powerful story. How do you feel physical therapy and chronic illness really interact?
Yeah, most Americans sadly don't move enough despite proven benefits, such as reduced risk of cancer and chronic diseases and improving your bone health, cognitive function, weight control, and just honestly overall quality of life. And due to that lack of physical activity, many Americans have or are likely, sadly, to experience, chronic illnesses such as heart disease, diabetes, depression, and obesity. So we as physical therapists, we're known as movement experts, specialists. And, our goal is to improve the quality of life through prescribed exercises, manual therapy, and patient education. After we make a diagnosis, we create a customized treatment plan that helps our patients improve their mobility, manage their pain, and other chronic conditions, as well as recover from injuries and prevent future injury and chronic diseases. So we can play a huge role for individuals with chronic illness and prevention just through our customized treatment programs and comprehensive evaluations.
Interesting. Can you speak to some of the benefits of physical therapy for individuals living with chronic illness?
Absolutely. So there's honestly, it's probably endless, but I'll share a few. So regular physical activity can really benefit your physical, mental, and social health. It also helps to prevent or improve many chronic conditions, such as I mentioned earlier, like heart disease, diabetes, obesity, depression, but even some cancers. And physical therapists help people overcome those barriers to physical activity. I mean, what we do is, what's really amazing about what we do is when we evaluate that person, we really have a very holistic approach so that we see them far beyond their physical capabilities. We take into consideration perhaps their occupations, perhaps their finances, how they socially interact in the communities, or even just their emotional state. But keeping all of that in mind, we can truly come up with a very personalized program that meets their specific needs and their challenges perhaps in life in order to meet their specific goals. And we help strategize, of course, with them, utilizing oftentimes motivational interviewing to help them, achieve those goals. And we treat actually individuals of all ages and disabilities. So it's not even just a unique group of people. All individuals actually have the same approach.
Can you speak to some of the challenges that might arise for individuals with chronic illnesses, especially as it relates to with physical therapy?
Yeah, there's sadly there's quite a few, and so I'll kind of go into these and a little specifically. So first, just a thought is lack of transportation. Depending on the age group, I mean, I've had, of course, my young kids that perhaps parents are working, right now, especially in a pandemic, parents are, having to work either from home or perhaps they're, working long hours now. So it makes it very difficult sometimes to transport their children. Our elderly folks also struggle because they may not even be able to drive. They may not be able to have a vehicle or perhaps a sibling or a child that can transport them. So that certainly can be a barrier. And of course, just I would think of middle-aged individuals, their work. So, either you can possibly fit it in the beginning of your day or at the end of the day, but, a lot of us have, children, which makes it really difficult. So that can be obviously a huge, huge barrier. And then also, if you think about rural America, here, I'm actually from the state of Minnesota, and here 80% of our counties are underserved. And if you look at the map across the country, of course, there's a large percentage as well that are underserved. And so access to care can be very limiting. Just to give you an example, there are areas in our northern part of our state where the closest clinic is anywhere from 30 to 50 miles. And that is true in many other states across the country. So of course, that can certainly delay care, access to care, and sadly, unfortunately turn an acute injury into something extremely chronic or unfortunately never really treat the chronic illness, which then of course leads to other comorbidities, unfortunately. And then as far as for the elderly, I also want to highlight just the mobility that sometimes is required to perhaps go to a clinic. Can be like to and from can be extremely challenging because it can be considerably taxing and very stressful. Also, sessions can take a long time. Sometimes you're waiting in the waiting room and so forth, and that can be very limiting too for them because their stamina might be limited. And so overall, the experience just becomes a huge challenge for that population. And then, of course, sadly, in this country, we certainly have those individuals that just lack adequate insurance or income to be able to cover expenses. Many insurance plans have high copays and deductibles for our type of services. So it's unfortunate that, as sad as it sounds, but there are plans that literally you're paying $75 a session just for your copay. It's ridiculous. Who could afford that session after session? If you think about my story, my gosh, had that been met, that would have bankrupted my family. So hence why, which essentially we had to go private pay. And thank goodness my therapist volunteered some of her time because most people cannot afford those type of services. But my parents, obviously sacrificed a lot to make it possible for me. But I was very fortunate, but there's so many that don't have those resources. And then, of course, as I mentioned earlier, I mentioned delays in care. Delay in care can come in many different forms. I mean, I just look at it right now. I live in the Twin Cities, Minnesota metro, and we're flooded with healthcare. I mean, there's just many different healthcare systems. We have numerous number of clinics. Despite that, we run into sometimes waiting a week, if not longer, for orders to be able to see our patients under insurance, which is, my God, ridiculous. What happens is because of the pandemic, some physicians are now being furloughed certain weeks. And I understand, talking to colleagues across the country, that this is happening across the country as well. So they may be on 1 week, off a week. So covering physicians don't necessarily, or providers, whether it's a nurse practitioner or physician assistant, may not be comfortable, covering for that clinician because they obviously have their full load as well because they're so limited in help in the clinic. So then we're looking at a week to 2 weeks perhaps to get an order to see an individual. And most insurance require that prescription in order to be able to see our clients through insurance. So unfortunate delays in care, and that could be anyone for that matter. And then, of course, there's the long waiting list as well. Well, of course, in rural America, if there's only one clinic for individuals within a 30 to 50 mile radius, there probably is a long waiting list, right? But also in the cities, you'd be amazed. I actually looked into this in preparation of this podcast. Just yesterday, I called my local clinic, which is walking distance from my home. There's a 6-week wait today to see the physical therapist on site. Who's going to wait 6 weeks if I just had my rotator cuff repaired, to have further care? And I'm actually in the Twin Cities, like I said, Minnesota metro. So I can't even imagine. My gosh, it's painful to even think what rural America is experiencing today. So all challenges, of course, that people can be experiencing.
I do want to dive a little deeper on one of the ones that you mentioned with health insurance. So you mentioned essentially there's a cap on the amount of care you can receive, and from there it's figure it out on your own, right? In my mind, or you would think that it is much easier for the insurance company to bring in that physical therapist to work with the person to make them better, right? Essentially, rather than have prolonged, long-term associated costs with unmanaged, whichever condition, right? Why is that? Why aren't we looking at, why aren't we thinking long-term here?
So your question, what you're asking from my understanding is, why aren't we having more one-on-one care?
Needed when it is needed most versus just sort of capping the person and then saying, we'll figure it out on your own. And a lot of people are not able to figure it out on their own. So then they go, and then of course you're looking at more costs down the road associated, heavier costs down the larger bills down the road as a result. And what's happening today is that we're incredibly short-sighted in saying, it's done. Let's wrap it up. 4 months, 2 months, whatever that time period is. And you're capped at that, with again, not having sort of that long-term, sort of sight.
So you're really talking about the insurance company. Insurances are dictating these policies, right, that we're having to abide by. So, I can't stress enough, that's where we need to be advocating. That's who we need to be talking to, is sitting down with insurance companies and being able to have these conversations. From a lobbying perspective, I actually lobby for the Minnesota Physical Therapy Association. I'm actually headed to Washington, D.C. next week to lobby Congress. And granted, we're trying to change things legislatively on a federal level, but, hoping that it can translate down to then on a private scale level, because it's a lot of these private insurances we're running into issues, but even on a federal level. And what we hear, the message year after year, is there are no dollars to do that. they have to put caps on services, or they have to limit, so much, because there isn't this endless bucket of money. And so even though I feel like some of these programs are well funded, unfortunately, and what they've also shared too, that there's sometimes abuse of the system in certain parts of the country, and sadly, everybody suffers as a result. So, I mean, there's a lot of layers to this, right? There's many different variables that we have to consider. But I think the greatest thing, and what we have done too at my company, is urged every single one of our patients to communicate with their member of Congress and really stress the importance of getting adequate access to care and avoiding these delays of care, and also helping with the administrative burdens that sometimes also are part of this, that can certainly delay care, and as far as providing the quality of care that we want to. So for all those that are listening, contact your member of Congress, because it really has made a difference, because we've been able to do so much, especially for children and the elderly, over the years, by just giving our patients a strong voice on Capitol Hill.
And so coming back to why they should contact a member of Congress, how do you feel that one-on-one experience with patients really allows them to make better progress and have a better experience overall?
Yeah. So, I mean, it's invaluable, right? So that individualized approach, it provides high quality of care, because we're now patient-centered. Having this, but I mentioned earlier, that holistic approach, right, to their injury, their disease, their disorder. We have time to listen and really engage and get to know them holistically, and as far as what's important, what's meaningful, so that we can generate goals that are valuable to them, that hopefully, obviously, we are successful in achieving. And it also makes it easy, as I've already kind of alluded to, that relationship building when you're one-on-one, especially when you have a consistent therapist with you. It's so easy to develop that relationship. I have to tell you, and I think because our sessions are also longer, we tend to see people a lot longer than, say, the average physician, or a nurse practitioner, physician assistant. We're seeing them a lot longer, so we're able to build those relationships. And two, I think what's been helpful too is it also provides them the privacy to ask those questions, perhaps, that sometimes they may not feel as comfortable elsewhere in perhaps other settings or with other individuals, because we are spending time, because we have that trusting relationship. They can share more, which allows us to help them more, because we're able, again, to have those conversations to understand them more holistically, right? Looking at perhaps their social, their emotional, their financial, their occupational, their spiritual and intellectual well-being. And then, and I think also too, just having that one-on-one connection allows us to provide the adequate education too, for them to be able to understand perhaps what's necessary in order to achieve the goals that they want to. As far as the consistency goes too, another benefit to that of having, say, the same clinician in that one-on-one interaction is we're able to monitor progress so much easier, especially having the same clinician. That's obviously can be a challenge, but I know there's obviously a lot of my colleagues across the country that really work hard to ensuring that, because it's invaluable, especially today, especially in a pandemic. Certainly someone could be out of the office one week, and so then you're being shuffled to another clinician. So thankfully, I have to tell you, it has been really great to see so many of my colleagues across the country, having very safe practices to be able to stay engaged. And so fortunately not, being able to be that consistent therapist, because they're having all those safeguards to protect themselves and during a pandemic, which has been great. We've had numerous conference calls over the past year, and I think instilling those best practices to making sure that, you're wearing your mask, your shield, your gloves. I mean, seriously, some of us are required by our states, but some of us are really going on kind of more on the extreme side, just to ensure that everybody feels healthy and that we can continue to provide the care that we want to for our patients. It is also, I would say, communication is obviously invaluable in any relationship, but that having that one-on-one can also be beneficial in communicating also with their loved ones, their caregivers. Being there allows us to perhaps be able to engage in those individuals. Oftentimes, we will ask loved ones to be a part of sessions so that we can obviously keep them up to date on what the plan is, what the goals are, of course, that we've come up with our patient, but then also ways that they can also help support, right? And obviously research has shown when you have, this tribe, individuals that can support you, my gosh, you're far more likely to have successful outcomes. So that can be very, very invaluable. And then just quality time to be able to demonstrate, to observe, and also modify those exercises as well is great with that one-on-one. And then I would say our hands are invaluable. We're movement specialists, but I always call us too, we're manual specialists as well, manual therapy specialists, which really allows us to access and really evaluate tissue quality in any session. We're a touching profession. And so, I can't say there's ever a session where I'm not, engaging in some form of touch to help my patients either be relieved from perhaps any symptoms they may have, or just honestly, just for comfort and to calm them. And this, during a pandemic, you can imagine the anxiety and the depression that we're seeing. It's overwhelming that we're seeing in the communities. So that, I have to tell you, has been probably a highlight of every session, to be able to hold someone's hand. And granted, I'm wearing gloves these days, but it's still incredibly rewarding to be able to do that. And I can tell they feel comforted by that. And then also I would say that one-on-one allows for fewer distractions too. We're not, the phones aren't ringing. There isn't, all these sirens in the hallway or wherever, depending on the setting that you're working on, perhaps, but it can certainly make a world of difference, perhaps, where you're just, right there with the patient, present, listening, and engaged.
We're going to round out to the last question here. What are some of your recommendations for physical activity for individuals, particularly with chronic illness like diabetes?
Yeah, so great question. So there's quite a few things, but we'll start with aerobic exercise. So think about walking, cycling. So if you like that bike, oh my gosh. And these days, with the pandemic, everybody's getting a Peloton or, anything like that. Oh my gosh, they've been wonderful for many of our patients. Jogging, of course, on your treadmill, and swimming. Those are all great forms of aerobic exercise. Resistance or strength training, also known as strength training, can be invaluable. With aerobic, you have to do that resistance training as well. And that is, exercises with free weights or even your body weight. My gosh, like even just standing up and sitting down from a chair, crossing your arms can be invaluable for someone, especially the elderly, or elastic resistance bands. There's medicine balls. There's so many different things that you can actually purchase easily and have in your home. And then as well for injury prevention, I always say flexibility exercises can be very helpful, not only to improve range of motion, but as I said, injury prevention. So don't forget about your stretching before and after exercise. And then for those that are having balance issues, which can be the case, especially if you're having perhaps peripheral neuropathy or your sensation is being affected in your feet, you may have some, or edema perhaps, you may have some issues with your balance. So you would benefit from definitely incorporating some balance, both static and dynamic, into your program. But overall, I would say contact a physical therapist to get that, remember, that personalized program specific to your needs. And then we would recommend doing daily exercise, at least not allowing more than 2 days to lapse. So trying to do something at least every day. And I would say those resistance exercises should be done every other day. And what research has shown, adults with type 2 diabetes should ideally perform both aerobic and resistance training for optimal glycemic and health outcomes. So can't stress enough those two. As I mentioned, those are the two that are most valuable. And at least getting 150 minutes a week of physical activity. And of course, looking at your nutrition is very valuable as well. So thank you for the question.
Yeah, no, and I second the part about nutrition. Of course, all bias is included there. With that, Dr. Norman, how can our listeners connect with you and just learn more about your work?
Absolutely. So, well, there's many different forms, but I would say the easiest that you can get in touch in any way is through our website, liveyourlifept.com. You'll actually have access to all of our social media. Follow us, like us. We'd love to hear from you. Seriously, post questions. We always love engaging with the community. And you'll also have access to our blogs and also all of our emails. All of our clinicians' bios with their emails are there. So if you want to send us, any one of us, an email directly, you're more than welcome to.
Lovely. Well, thank you so much for your time, Dr. Norman. It was a pleasure having you on. And to our listeners out there, head over to our social media and tell us, what is your favorite physical therapy exercise to do and how can you modify it at home? We'll see you there after the episode.
Thank you for listening to the Yumlish podcast. Make sure to follow us on social media at Yumlish_ on Instagram and Twitter, and at Yumlish on Facebook and LinkedIn for tips about managing your diabetes and other chronic conditions, and to chat and connect with us about your journey and perspective. You can also visit our website, yumlish.com, for more recipes, advice, and to get involved with all of the exciting opportunities Yumlish has to offer. If you like this week's show, make sure to subscribe so you can hear more from us every time we post. Thank you again, and we'll see you next time. Remember, your health always comes first. Stay well.